A patient has the following ABG, which is arterial blood gas, pH 7.6, carbon dioxide 60, sodium bicarb 32. What is the acid-base disorder present in this patient? Easiest way to solve this question is just to memorize the chart, right? So you have to memorize the normal values. The normal pH is 7.4. Normal carbon dioxide is 35 to 45. And the normal carbon dioxide is 22 to 26. And then you see if it's higher or lower. So pH 7.6, that is higher than the normal pH. So right now I already know that's alkalosis, either one of these two, alkalosis. And then next I'm going to see if the carbon dioxide is increased or decreased. So carbon dioxide is 60, so it's much higher than the normal. So I know it's metabolic alkalosis already. Because if it was respiratory alkalosis, the carbon dioxide would be lower than the normal. But since it's higher than the normal, I already know that it's metabolic alkalosis. That's why my answer is C. But sometimes this chart is kind of hard to remember. So what I usually like to do is just see if something's agreeing with the acidosis or disagreeing with the acidosis, and vice versa with the alkalosis. So one thing for sure you have to memorize is normal pH is equal to 7.4. And so since this pH is higher than 7.4, I know it's alkalosis. Because pH is greater than 7.4. So next I'm going to look at the carbon dioxide. That equals 60. And so whenever I see carbon dioxide, I think of it respiratory because you breathe out carbon dioxide. So I consider respiratory acid because you breathe out acid. And so you see this carbon dioxide, it's higher than the normal because the normal carbon dioxide is between 35 and 45. So this suggests that it's acidosis, but I already saw from my pH that it's alkalosis. So that's why this is not agreeing with alkalosis. Well, this is actually compensating if you fully understand what ABGs are. That's why this is higher. So I'm trying to find out what agrees with this pH. So now I'm looking at bicarb, that's 32. And so the normal bicarb is between 22 and 26. So this is elevated. And then sodium bicarb I consider to be metabolic alkalosis because it's inside the body. So if this corresponds with this, so this does agree with alkalosis. So I know it's metabolic. So that's why my answer is metabolic alkalosis. If you have any questions, please leave it in the comments.